Hi everyone and welcome to Dr. Jankila's lectures. Today's lecture is about the mode. Mode is basically the value that occurs most frequently in a set of data. Let's take this example to better understand what the mode is. We have a student who comes into class and he's trying to find out the favorite color in the class by most students. So he goes in and he asks every single classmate and he finds out that 15 students, their favorite color is black, red, 25 student, blue, we have around 10 students, and purple around 7 students. By definition, the mode, it's the value that occurs most frequently. Based on that, the mode of this chart or this study for class favorite color would be red. The mode could be used in different ways. It's not just for favorite color. It could be used in different settings. So for me as a pharmacist, the mode could be used in a clinical trial, in a study where they're examining a medication in order to be approved later on in the market. So let's say they're using the mode in this study and they're using it for a side effect. So there are two different side effects that are happening. So the mode could be used to know what is the value or what is the side effect that is occurring more commonly with the participant. So let's say 95% of the participant, they're having a stomach upset and 5% they're having a headache. So for me, it would be really important if this medication goes on and gets approved to know that the mode of this medication side effect, 95% of it was a stomach upset. So for me as a pharmacist, it would be important to let the patient who's coming to pick up this medication, to let them know that there is a high chance of this medication causing a stomach upset. So for part of me as a pharmacist would be educating the patient to take it basically with food to prevent that stomach upset or to help with that stomach upset. Therefore, it could be used in different settings and based on studies. And one thing to keep in mind that when a distribution has two modes, it's called basically, for example, over here we have the blue and the black. Both of them have a number of students, let's take going back to the favorite color. We have 15 students saying that blue is their favorite color and 15 others saying black is their favorite color. In this case, we have two modes in this chart. And this is called bimodal. That's what that is called. And it's possible to have that in data. So basically going back to the side effect, it could be the stomach upset and the headache, they're happening at the same ratio, 50% and 50%. So that would be the case when we're having two modes in this study or chart. Another thing that I want you to keep in mind is that mode, sometimes it's not very useful. So looking at these two charts and going back also to the example we gave, the class favorite color, we see that in this study over here or this chart over here, we have 20 students saying blue is their favorite color. And here, let's say this is first year pharmacy student, so this is P1, and this is second year pharmacy student or P2. So in first year pharmacy student, they said that blue is their favorite color. And in second year, they said blue is their favorite color. So we see that there is 20 student here, 20 student here that having two different classes, however, the mode is the same thing. So the conclusion from these two studies would be a blue is P1 or first year and second year pharmacy student favorite color, therefore the mode is blue. However, that doesn't explain the rest of the data. So here we have black. Let's look at the black. We have around 17 students over here that their favorite color is black. So what about these 17 students, which is so close to the 20 students over here? The difference is basically 3 students. So the reason why it's not very useful because it doesn't explain the rest of the data that it's happening. And this is very important to consider. Just because going back to the side effect, stomach upset, let's say in this case would be happening around 55% and or actually 60% would be stomach upset and headache would be, let's say, 56%. Does that mean when a patient comes in, I'll only say, hey, you may experience a stomach upset and leave headache away? Of course not. I need to mention both side effects to the patient because they're so much equal to each other. They're not the same. The mode would be stomach upset. However, mentioning both side effects or considering all the data would be really important. This is why the mode is not very useful in certain cases. And the mode is basically or mainly used with nominal or ordinal. So when it comes into nominal, this is basically when we have a yes and no question. So let's say a student goes into their class and he's trying to find out the mode for gender. What is the mode over here? What do we have, more females or more males? So he goes in and he asks yes and no question. And the student receives a form, says, are you a male? Yes. Are you a female? Yes or no. So this is basically nominal. It's basically a yes and no question. When it comes into ordinal data, this is more from the, ordinal comes in from the word order. So this is basically data that goes into order. So let's take an example would be pain scale. So taking pain scale in this case, we know that when we're going, let's say a patient goes into a clinic and the nurse is asking the pain, where is your pain from 1 to 10, right? So 1 to 10, where is your pain? The patient number 1, so patient 1 says, my pain is 2 out of 10. Patient number 2, so this is patient number 2 says, my pain is 4 out of 10. Over here, it's in order. We're going from 1 to 10. The difference is that, or something that makes the ordinal data different, is basically based on categories. So it goes in from 1 all the way to 10. It's in order. However, just because patient 2 has 4 out of 10 doesn't mean he's experiencing twice as much pain in comparison to patient number 1, which is 2 out of 10. Mode is represented in this way. So it is only represented with number. It could be number of patient, number of student, number of whatever we're measuring in that case. This is a number, n is number, and then with a percentage. So whenever you're going to look into study or you're going to look into, in any situation the mode is used, you're going to be seeing number and a percentage. So here, looking at this, another thing to keep in mind is that the mode comes into different ways. It can come in pie chart. Over here, we see the distribution of these data. Can come in bar chart, just like we have all these examples. And it can come also with tables. So looking at this pie chart, we can see that there are 25 students out of 100%, 25, they have 25%, it's blue, 24, 24%. These numbers, just to make it easy, I picked them out of 100 and I made them the number and the percentage to be the same. It could be different. It could be 6 students and it's 10%, or 25 students and that's basically 75%. So just one thing to keep in mind, it's always a number and a percentage and not just one of them. So this is always something to keep a look on when you're looking in a study, and when you see a number and a percentage, think of a mode. So this is it for this video. If you have any question or comment, please leave them in the comments below. And as always, thank you for watching.